the leg's kind of like the arm. Remember how you had all those different layers and when they kind of built on top of each other? So we're going to do the same approach, and we'll start with kind of the deeper muscles of the leg and build on top of those as we go. So I've got the skeleton, like just a rough sketch of the skeleton in orange, and then just the periphery of the legs in green that I'll use as a guide. The first kind of muscles that we'll talk about are called our hip flexors. Okay, so these guys are the muscles that like help to flex the hip. The first kind of group of muscles are called the iliopsoas, and I will draw these guys in blue. So iliopsoas. They're actually a collection of two muscles. If you label them either one iliopsoas, that's going to be correct. Okay. The first part of the iliopsoas is called the psoas major. What this muscle does is he actually starts at our lumbar vertebrae, and he stretches down between the pelvis and inserts right here on the lesser trochanter. Remember the femur? You had the greater trochanter right here and the lesser trochanter. So that lesser trochanter serves as the attachment site for this pretty large muscle that starts way up here and stretches all the way down and inserts right there. And you can kind of see how if he contracts, he's going to pull that femur up like this. It's going to help to flex the hip. If this guy gets tight, he causes a lot of back problems because you can see, I mean, he's stretching from basically these lumbar vertebrae all the way down to the lesser trochanter. So if this gets tight, it's just going to put a lot of stress on the lower back. And that's a common cause for like muscle or lower back strains is a tight iliopsoas. So that's the psoas major. The iliacus is the other part of the iliopsoas. He starts right here on the inside of the iliac crest. He starts right there, and he stretches down and also inserts on that lesser trochanter. So all that muscle tissue is just pulling on that lesser trochanter to get him to swing up. Okay? So that's the iliopsoas. I'll kind of outline them once we build up the skeleton a little bit more. The next set of muscles that we need to talk about are called the adductors. So these are a set of muscles that are basically going to adduct the leg towards the midline. So they're going to pull on the leg and have it kind of come towards the other leg. Otherwise known as the groin muscles. So we've got one that is called the adductor magnus. And the adductor magnus is a really broad muscle, okay? And I draw him now because we basically cover him up 90% of him, and you'll see this tiny little corner of the adductor magnus after the drawing's complete. So I'm going to draw him in green. So the adductor magnus. What he does is that he starts all along here, along the ischium. He'll start right here and he stretches all the way over here. And this guy spans basically the entire inner kind of surface of the femur. So a very broad attachment site. And you can see that as he contracts, he's just going to pull that femur in. Okay? Unfortunately, a lot of this adductor magnus is going to get covered up with the muscles that I'm going to draw like right now. One of them, the first guy that covers him up, is a muscle called the pectineus. And after we draw all these, I'll kind of go over the order so you can get a better idea of exactly where they are. Right now, just get a sense of how many are in there, I guess. So the pectineus, I'm going to draw in red. This guy stretches from this part of the, from the pubic region of the pelvis, and he stretches right over here and covers up a portion of the adductor magnus. So that's the pectineus. Beside, in addition in here, you're going to have the adductor longus. This guy starts, I'm going to draw him in brown.
Did you say adductor?
Adductor, A-D-D. This is really good. This is the adductor. This is the adductor magnus. That makes sense because he's adducting that leg when he pulls. And the adductor longus is situated right here. His origin is right beside the pectineus, and he's going to stretch down and attach right there. So we've really covered up almost all of that adductor magnus. Okay, let me outline these guys so we can get a better sense of exactly where they are. Okay, so here's the pectineus. He stretches from here to here. The adductor longus stretches from there to there. And then underneath we have the adductor magnus in green, which we're going to continue to cover up as we build this leg up. Okay, but those are your groin muscles that help to just adduct this guy closer. Okay, now is a good time to actually talk about the quadriceps. So I'll outline this guy as well. Okay, so the quadriceps muscle is, I mean, we're familiar with what this guy does. The quadriceps muscle is a big knee extensor, and it's all this big muscle that's on the anterior side of your thigh. He consists primarily of 3 large muscles. The one in the middle is called the rectus femoris, and you have the vastus muscles on each side. You have the vastus medialis and then the vastus lateralis. Together, these 3 guys make up that large quadriceps muscle. We'll start with the rectus femoris. He's right in the middle. What he does is that his origin is right here. This is the iliac spine. Okay, so the iliac spine, which is right underneath the iliac crest. His origin stretches between the top of the iliac crest down to the acetabulum, which is where the femur goes into the femur. He starts here and he stretches all the way down and he inserts onto the patella. Okay, and that makes up part of the knee. So I'm going to draw this guy in a purple. Okay, and this is the rectus femoris. So this guy starts here, and he's going to stretch all the way down like that, and he's going to stretch all the way down like that, which means we have to erase all of those muscles that we just drew because they're covered up, but at least we know where they were because we drew them for a second, hopefully. So we're going to erase all this down here, all that. Perfect. So all this is going to be covered up with that rectus femoris. I'll draw in the fibers like that. And that's the middle of the quadriceps muscle. And I can outline him because he is definitely not going to get covered up by anyone. We'll just outline him like this. And he connects to that patella through, anybody know what the name of that tendon is?
Patellar ligament?
Patellar tendon. Tendon, right? That's perfect. So, or actually, no, I was wrong. This is just the tendon of the rectus femoris. The patellar ligament is further down. I was tricking you guys. Okay, so here's the patella right here, and then the patella, so the rectus femoris transmits force to the kneecap, and then the kneecap is going to connect to the tibia through the patellar ligament. And we learned about that because we learned about the knee. Okay, so that's the middle of the quadriceps. Now, on either side of the quadriceps, you're going to have these very large vastus muscles. This is the vastus medialis and the vastus lateralis. Okay, these guys, let me draw him. All right, I'm going to draw the vastus medialis. Is going to be on this side. And this is a pretty large muscle that has this shape. Okay, so he has this kind of fiber angle, and what he does is that he comes down a little bit further, actually. He's going to look like this. Okay, and he curves up like that. Oh, I messed up. Okay. All right, that's your vastus medialis. And then your vastus lateralis is going to be on the other side. And that is going to complete our quadriceps. I'll draw the vastus lateralis in, let's see, I'll draw that in like this weird purple color. So the vastus lateralis is going to come out like this, and this is going to occupy kind of the lateral shape of the leg, and his fiber angle looks like this. vastus lateralis. Okay. And this guy is going to come up here. Oh, this is important. So the vastus muscles, their origin is actually the vastus lateralis. He inserts on the greater trochanter of the femur. So it's perfect that I drew him right here because his origin starts right here at the greater trochanter. The vastus medialis, his origin is right beside that, between the greater and the lesser trochanters of the femur. So that big ridge in the femur, that serves as their attachment site. So these guys stretch from here to there, and they have all these fiber angles that come in like that. And they outline him, and he looks like that. Okay, so that's your quadriceps. Now we actually have another muscle that starts right here at the tip of the iliac crest. So you can feel that little bump right here, that hard bump at the front side of your hip. So this is going to serve as the attachment site of a muscle called the Sartorius that starts here, curves all the way around to the inner side of the leg, and inserts on the medial side of the knee. Your model, he's a very distinct muscle. He looks like a little snake that curves all the way around. Okay, that's called your Sartorius. What this guy does is, I'm going to grab this purple to draw him. Let me see if he's different. Yeah, this is Sartorius. He's going to start here, and he's going to curve down and insert right there. So we're basically covering up all this hard work that we did, but that's okay, to make room for the Sartorius. So in this case, he's going to start right here at the anterior side of that iliac crest. He's going to come down and curve around like that. Everybody with me? And that's your Sartorius. He's one of those good landmark muscles. Like if you can find him, you can work out from there and try to understand where everybody else is. Now we're kind of at a good point to stop and work on that left leg, because we kind of worked on the right leg, and we can work on that left leg to kind of fill in some of our missing pieces. We'll start with the iliopsoas. We know these iliopsoas are going to start right here, and they're going to stretch down to the lesser tubercle, which is right about, well actually, I'm not going to cover everything up. I'm just going to start with the more superficial ones, and we'll fill in from there. That way it'll go faster. So in this view, you definitely are going to be able to see the rectus femoris that extends up. He's going to extend up like this. Okay, so that's your rectus femoris. Comes down like that. You'll notice that this left leg is kind of twisted, so we can see more of the medial surface. That's good. Okay. What muscle is going to be right here? This is the vastus, what, medialis or lateralis? Medialis, for sure, because we're looking at that medial view. So that vastus medialis is going to be right here. He's going to stretch up like that. Flanking that vastus medialis, we're going to have our good old Sartorius. He's going to stretch around like this. Starts right here, and he's going to go down like that. Okay? Fill this guy in like that. Perfect. All right. Then, oh no, I messed up this. Okay? So let me outline these real quick so we get some form here. This gives us our knee. Then we have our Sartorius that comes down, wraps around like that, and our vastus medialis that looks like this. Okay? Now, what we can draw is, there's a muscle, and he's another kind of landmark muscle. This muscle starts at the medial side of the knee. That's his insertion, right beside the Sartorius, and he's the only muscle that goes directly up the middle of the thigh, and his origin is right here at the pubic symphysis. So he goes straight from the pubic symphysis, down the medial side of the leg, inserts right here. That's called the Gracilis. And you can see him in your model. If you look at the model, he is right there. He's that muscle that goes top to bottom, right on the medial side. I will draw that guy in this like dark brown. What's that? His origin's the pubic symphysis, that's right, and his insertion is on the medial condyle of the tibia, right? So this whole collection of muscles insert right here. So I'm going to draw him right here because you can see him perfectly, right? Pubic symphysis, and he's going to stretch down and insert right there. And he's a pretty broad muscle. It kind of looks like that. Okay, that is your gracilis. It kind of comes in like that. You label him. This is Gracilis. Okay. In this view, you're going to see that Gracilis come down like this from this other leg, and he's just going to occupy that lateral border of the leg, and he kind of gets covered up by the Sartorius because of how the legs turn. So it goes down like that and down like this. Okay. Good. All right. So what this leaves us with is hopefully, like sometimes this doesn't work out perfectly because I build it up, but eventually, like this leg is pretty much complete. And what you'll see is that you have this order of muscles on the inside of the leg. If you start with the Sartorius, right, on the inside of the Sartorius, that's where you're going to see the Iliopsoas. So I don't know if this is actually going to work out exactly how I wanted it to. But you're going to have the Iliopsoas, which are going to be located right here. They're going to come down, and they're going to be positioned like right here, right, as they kind of come down like this. So those are all Iliopsoas. Then next to the Iliopsoas, that's where you're going to see the pectineus that stretches from here in. Right? Pectineus is right there. Next to the pectineus, that's where we'll see that adductor longus. And I picked the same color for neighboring muscles, but that's okay. This adductor longus is going to come in like this. Oh, well, this is just a good indication to change colors for him. We'll do this brown for the adductor longus. Okay. So perfect. And then if I did everything exactly right, which I didn't really do it, but that's okay, right next to the adductor longus is going to be the gracilis. And your model shows that really well. Okay? So it goes like that, and like that. I kind of messed up because you have some blank space here. I think that's because my Sartorius is too small. So I can fix that. And I'll fix that right here. So this is the take home after I fix this little error. So here's the Sartorius now. What you'll see is you got, let me see here. Yeah, that doesn't look too bad. So here's the order of things. As you go from the Sartorius to the gracilis, okay, between the Sartorius you'll find the Iliopsoas, the pectineus, and the adductor longus, and then finally the gracilis. So if you start right here, here's the Sartorius. You have Iliopsoas, pectineus, adductor longus, gracilis. Okay, and so that's really the order that you need to be aware of. And that's it for the upper thigh. The good news is the lower thigh is a lot simpler. Okay? What you'll have in the lower thigh is that you'll have the gastrocnemius, which is right here. That's our calf muscle. I'll draw him in red. So the gastrocnemius is going to be located right here. Right? And so he's going to have these fibrangles that come in like that. Kind of like that. Okay. That's your gastrocnemius. Okay. Then, underneath the gastrocnemius, you're gonna have another muscle that makes up our calf. So the gastrocnemius is more like the superficial muscle of the calf. Deep to the gastrocnemius is gonna be this muscle called the soleus. This guy is this broad muscle that you'll see kind of underneath the gastrocnemius. He actually is very broad and he occupies that entire space underneath there. So the soleus, I'll draw him in this green color. He's a broader muscle that kind of comes in like this, where you'll have the soleus that kind of comes up like this and occupies the space underneath the gastrocnemius, kind of like that. Both of those guys transmit force right to the heel through the calcaneal tendon, through your Achilles tendon. So here's the gastrocnemius that comes in like this, right? That's all gastrocnemius, and then soleus is underneath him. And then this is just literally part of the tibia that's exposed. Okay, gastrocnemius, and then soleus. And both of those guys transmit force to the heel. Okay. So that's not too bad, right? Just gastrocnemius, soleus. Then we've just got a couple muscles that are going to be on the, what's it called? The lateral side of this lower leg. The couple muscles that you'll see there, let me just draw the toe real quick, I guess. Alright, the couple muscles that will be on this side. The first one is called the tibialis anterior, and that makes sense because he's a big muscle on the anterior side of the tibia. I'll draw him in purple. So this tibialis anterior is going to start right here on the lateral, just on lateral to the patella, and he's going to stretch down. And when he gets down here, he actually crosses over and inserts on the medial side of the foot. And that marker just died on me. I'll grab another purple. I'll use this purple. So the tibialis anterior comes in like this and comes around. And you can really see how he's on the anterior side of the tibia. If the tibia was right there and he was on the anterior side, he comes down and he inserts right there. That's your tibialis anterior. And if I were to outline him, he kind of looks like this, where he'll come down, he'll start right here, comes up. His origin is the kind of the lateral condyle of the tibia right there, and his insertion is on the first metatarsal. On this view, because the leg's kind of turned out like this, you'll see that the tibialis anterior kind of occupies this border of the foot. Oh, this marker's dying too. But he comes down and inserts right there. What do you think his function is if he inserts right there? Yeah, he just dorsiflex, causes dorsiflexion. He like causes your toes to point out, not your toes, but your foot to flex, ankle to flex. This is bone. I mean, this is bone, and you can feel that on your leg. You know, there's a part of your lower leg that's not covered by muscle. That's just bone. Okay. Next to the tibialis anterior, we have a muscle that flexes 4 of our toes, our 2nd through 5th toes. This is your extensor digitorum longus. Kind of a perfect name. Extensor digitorum, and he's got a long tendon. So this guy starts right here beside the tibialis anterior. He stretches down like this. And when he gets down to the foot, he's going to spread out and insert tendons on our 2nd, 3rd, and 4th toes. That is your extensor digitorum longus. And this guy is pretty simple. He just comes down and then spreads out and inserts on those toes. Cool? can't see him from this view. All you'd be able to see, because he's kind of turned away, you would just see the tendons that run out to the toes. And that's all you'd be able to see. Next up, we just have two muscles that hang on top of the fibula. You've got the Fibularis longus. He's the one you most see, all right, and he's going to be located right out here. And then you got the Fibularis brevis. So the Fibularis longus, Fibularis brevis. Fibularis longus, oh, what can I draw him in? I'm running out of colors. How about this brown right here? Oh, that'll work, that's perfect. So the Fibularis longus starts all the way up here, right beside the tibialis anterior and the extensor digitorum longus. He's going to stretch down here, okay? And what he does is he inserts at the base of the fifth metatarsal, okay? So he inserts right here, right here at the base. When he contracts, he causes dorsiflexion, but he also causes eversion. Remember eversion, where like the side of the foot goes out? And that makes sense. If he's going to pull on one side of the foot, he's going to cause that foot to evert. So that is the Fibularis longus. Okay. The Fibularis brevis actually lies underneath that guy. The Fibularis brevis lies right underneath him. You can kind of see that on the model. He'll emerge at the distal kind of end of the lower leg. He emerges. I'll draw him in this weird purple color. So the Fibularis brevis is going to emerge down here. He kind of comes down, and what he does is he wraps underneath the foot and inserts on the base of the first metatarsal. So that's why he's called longus. He has a long tendon that goes all the way underneath and attaches here. He also causes eversion. And you can kind of see that. If you were to pull, he's going to cause that foot to swing out like that. So we got the Fibularis brevis that emerges more distally. This tiny little guy right here. Okay. So that worked out pretty good. The only place that I really messed up was here. I just made the Sartorius way too skinny, and so he didn't take up enough room. But other than that, I think it kind of turned out all right. Right? I just need to make this Sartorius a little bit thicker so that he doesn't show as much of the leg. But what you can see is that it's kind of funny how, remember our old adductor magnus that we drew, and he's like this big old muscle? He's gone. Like you can't see him at all from this frontal view. You can see a little bit of him from the back view, which we'll do in a minute. About the posterior side is we've actually already talked about a lot of the muscles. So some of these are going to be repeats, which makes it kind of easier. And you can't see as many muscles from the posterior side. One muscle that is really important that I completely forgot to mention is this muscle that actually emerges right beside the Sartorius and kind of goes laterally. This creates a V that kind of encases the whole quadriceps muscles group. This is called the tensor fascia lata. And in this guy, I will draw him in an orange. I haven't used orange yet. So this tensor fascia lata is going to come out like this and form a V going in the other direction from the Sartorius. So he's going to come out like this. And that is the tensor fascia lata. Okay. And if I outline this guy, he just looks like this. Okay. And he curves to the other side of the quadriceps. Okay. So if we go over to this back view, probably the most obvious muscle is your gluteus maximus. This is your butt muscle. Okay. And so this guy is going to start. What else? I'll draw him in red. How about red? So this gluteus maximus, what he does is he has fiber angles that start right about here and extend down. And what this guy does is this guy is really important and active in extension of the hip. And so when you're going from like a squatting position to an extended position, that's where that gluteus maximus is going to be really active. And so this gluteus maximus transmits force onto the that broad band of tendon on the lateral side of the leg. That's your iliotibial tract, and you can really see how that gluteus maximus wraps around and transmits force right onto that iliotibial tract. Okay, and that's basically what he looks like, kind of like that. This one is going to kind of go down like this. All right. Let me just draw the fiber angles really quick so we can be done with it. Right. And that is your gluteus maximus. So, gluteus maximus. On top of that gluteus maximus, you're going to have the gluteus medius. This guy, I'll draw him in this green color. So the gluteus medius. He is going to have fiber angles that kind of come like this. He is going to be extend underneath that gluteus maximus. Okay, so you got the gluteus maximus there, the gluteus medius above it, kind of in that arrangement. And this guy transmits like that, goes like this, and then over here goes like that. I might have to try that again. It's a weird looking rear end. Weird looking butt. That's okay. That's just how it is. Poor guy. A little uneven. It's okay. We might have to work on that one. What's the name of the muscle that occupies the medial side of the leg? He stretches from the medial side of the knee all the way up to the pubic symphysis. Gracilis. Perfect. And so I'm just going to draw him because we've already drawn him. We've already labeled him. The gracilis, what he does is he is going to extend perfect from the medial side of the leg all the way down like that on both sides. So you'll have a gracilis over here, you have a gracilis right there, and you know he's there because he's got to occupy that medial side of the leg. So that's going to be your gracilis. Don't even have to label him because I already did. And he extends down like this, extends down like that, and then like that, and then like that. Okay? Now, right next to the gracilis, this is where you'll see that tiny little part of the adductor magnus. We finally get to draw this guy. And he extends out right here. So right between the gracilis, where the gracilis meets the gluteus maximus, that's where you'll see a tiny little bit of that adductor magnus. And you can even see this in the model. See right beside the gracilis, boom, that little part right there. He's actually a pretty big little body of the muscle that you can see between right beside the gracilis.
What's the one in front of it?
So that's gracilis, right? Gracilis.
Oh, that is.
Yep, this one right here.
Then what's
That's Sartorius,
okay.
right? And the Sartorius, the key there is he stretches all. He's the one that wraps around. Okay. So we got the adductor magnus. Now we can kind of talk about the hamstrings. The hamstrings are the muscles in the posterior side of your upper leg. These flex the knee. You got two different sides. On the lateral side, this is where you'll have the biceps femoris. The lateral side of the hamstrings is called the biceps femoris. What this guy does is he's going to stretch down like this and wrap around. This is the large muscle on the lateral side of the leg. He looks like that. And on this side, you're going to have the same guy. And he's going to look like that. So this is biceps femoris. Okay. And this guy's going to come down just like that. Okay, and just like that. And that's half of your hamstrings, but just remember he's on the lateral side. Biceps femoris on the lateral side. Kind of makes sense. The biceps brachii, that flexes the elbow. Biceps femoris flexes the knee. Okay. Then the other side of the hamstring is composed of two different muscles. One is kind of broader and he's deep, and the other one is a little bit thinner and he lies on top. This is the semimembranosus This is the broader muscle that's deep, and the semitendinosus lies on top of this guy. So I'll draw it kind of like this. I'll use this dark blue color for the semimembranosus. He's going to extend out beside that adductor magnus, come down and wrap around in this direction. He's going to be pretty broad. Okay, so he's going to extend down like this. Right, and on this side he extends down. Oh, I messed up. Sorry. Extends down like this. Okay, so that's your semimembranosus. He's broader, and then on top of him, that's where you have your semitendinosus. I'll draw that guy, and I need like a very obvious color. Maybe this orange. The semitendinosus. He lies on top, and so he's going to be this smaller muscle that lies right on top of him and goes down. You guys kind of see that? Yeah. And so he lies right on top and kind of curves down. So orange is on top of purple. Let me outline these to try to make it a little bit clearer. You're going to have the gracilis. That orange looks just like the brown of the gracilis. Oh well. My color scheme could have been better, but you guys get the point, right? Just remember on the medial side of the hamstring, two muscles, semimembranosus on the bottom, tendinosus on top. Always remember it like this. Membranes, I think of them as being wider than tendons. Like tendons, you think of them as being these thin, strings. So a membrane is underneath, he's wider than the tendinosus. The distal side of the leg, now we're just looking at the gastrocnemius. So the gastrocnemius, I drew him in red. You can see him quite clearly. He's got two heads. He's going to have a medial head and a lateral head. He's going to come in like this, right? He's going to have kind of this shape. Kind of like that, right? So you're going to have the gastrocnemius kind of extends down like this. And then like this. The gastrocnemius, his origin is actually on at the condyles of the femur. So he stretches up onto the upper leg and he extends down. He forms a tendon that is going to insert right here at the heel. So here's the heel, right? That tendon to the gastrocnemius is going to come down and insert right there. Okay, and on this leg, he's going to come down and insert right here at the heel. Okay. What is the name of the muscle that's underneath the gastrocnemius? Soleus. I drew him in this green color. So you'll be able to see the soleus, but only at the distal portion. And this is important. So the calf muscle, all the meat that's closer to the knee, that's mostly gastrocnemius. But you have all this meat down here that's closer to the ankle. That's the soleus. So the soleus is really going to be located like right here. You'll see him down here.
It's on both sides.
On both sides, that's right. All right, he wraps around like that. And then he's going to be located right here. That guy's going to be located right here. And then right here. Too wide. That's all right. Right here. And right here. And then the beauty of this is that that's all you can see. Okay? Let me just make this a little bit clearer on the outline. Only thing I would have done differently is I would have made that semimembranosus a different color so that he stood out a little bit better next to the gracilis. You got the gracilis, adductor magnus, gluteus medius, and they were pretty much in good shape. Other than the guy's shape of his